Well, as the only practicing physician on this panel, I'd first like to start out by saying that I think I could speak for my entire profession by stating that our current healthcare system is in serious need of reform and that the status quo is unacceptable and ultimately untenable. But I find the question that I'm being asked in this debate, is more government the answer, to be rather ironic. 50% of every healthcare dollar spent is by the government within a government-owned and operated system via Medicare, Medicaid, the VA, and the Indian Health Service. 40% of the healthcare dollars spent are by private sector third-party payers that are heavily regulated and directed by the government, and 10% is paid directly out of pocket by the patient. So in essence, the government already owns half the healthcare system and controls the other half. Now, how does it control the other half? Well, let me count the ways. First of all, the government prevents health insurance from being sold across state lines, like we buy auto insurance, life insurance, homeowners insurance, and disability insurance. And that's because of a law that was passed in the 1940s, whereby the United States government actually waived its authority under the Constitution's Interstate Commerce Clause to break down barriers that states put up against one another to interstate commerce. So instead of having one national market of health insurance, we have 50 micro markets. There are some 1,300 insurance companies in these United States, but in some states only one or two are actually selling insurance. Could you imagine if the kind of competition that would develop where we could shop even online perhaps and choose among 1,300 competing insurance companies? Now here's another irony. While those in Congress decry the lack of so-called competition among the health insurance plans, their answer is to add just a single competitor, a government-run, taxpayer-subsidized public option, like Medicare, that we all know will not be allowed to fail. See, for example, the Post Office, Amtrak, Fannie Mae, Freddie Mac, and to add that one competitor, so-called competitor, to the mix, instead of allowing 1,300 competitors to be added to the mix. Another way that the government controls health care, the other half of health care, is by mandated benefits laws. Every state has laws mandating what can be covered, what deductibles can be maximally, what co-pays can be. The average state has 45 mandated benefit laws. States like California require that all health insurance has to cover marriage counseling. In some states like Arizona, it has to cover autism. Minnesota requires health insurance to cover men's hair pieces. I can go on and on. The point is that because states require that insurance covers a whole bunch of things and makes the choices for us, we're unable to shop cafeteria style and pick an insurance policy that meets our needs. And of course, adding all those things into the policy, for example, in my case, my children are growing up, I'm not worried about autism, but when I buy health insurance, I have to buy autism insurance. I'm not saying there's anything wrong with having autism insurance, but I don't need it, but I have to pay for it. Those kind of things raise the cost of health insurance. And then another way the government controls health care is through the tax codes, because the unfairness of the tax code punishes people who don't get employer-provided health insurance. They have to buy it with after-tax dollars. But if their employer provides them with health insurance, it's with pre-tax dollars. And therefore, there's every incentive for you to get your employer to make it cover as much as possible and have as low a deductible and lower copay as possible, because that you have to pay with after-tax dollars. And what does that result in? It results in your employer, in everybody wanting their employer to provide the health insurance for us rather than us getting our own. And so therefore, our employer picks our health insurance, we don't. Our employer switches insurances on us all the time, and we have to change doctors because of that. We have job lock, which we wouldn't otherwise have, but of course, if our employer provides the health insurance, then we are stuck having to stay with that job. And also, because the employer is providing the health insurance, and the health insurance is paying for 90% of the cost of health care, we have destroyed what could have been a market, because in order to have a functioning market, you have to have an interaction between the producer and the consumer. And the price is what ends up determining ultimately the way the transaction will be. But when you have almost no out-of-pocket coming from the consumer, then you have basically the doctor and the patient, neither of them are concerned with cost. It's sort of like if you sent your child to your kid to the Gap with your credit card and said, buy some clothes, just put it on my credit card. The salesman will say, well, step this way. Let's start with this rack right here and see what we can sell you. Also, I must say that I'm a little grateful here because the system actually, therefore, allows me to practice defensive medicine with abandon. Because every time I'm concerned, if a person comes to me, for example, with some time, okay, can I just conclude a remark? Okay. In conclusion, every moment of every day that I practice medicine, I encounter the effects of government. And it should be obvious that if we want real change, change you can believe in, then we want less government, not more government.